Hello. Welcome to my channel. In this video we will talk about the most important information about breast cancer. Signs and symptoms. Breast cancer. Cancer found in breast cells is breast cancer. A mass of breast tissue that grows in an abnormal and uncontrolled way as a cancerous lump. The carcinoid tumor may attack surrounding tissues or secrete cells into the bloodstream or the lymphatic system. After lung cancer, breast cancer is the second most common cancer worldwide and the fifth most common cause of death. It is the most common cause of cancer in women in injury as well as death. It caused 502,000 deaths worldwide in 2005. The number of cancer cases has risen from 1970, which has to be blamed on the modern patterns of today's world. Breast cancer is the most feared disease among women, and it is the most common fatal heart attack among women. Mortality rates for this cancer have been declining in the past few years. This type of cancer also occurs in men, as the breasts in males and females are made of the same type of tissue. But it is 100 times less than women and has the same survival rates as women. The lump is difficult to feel in the breast, and has an irregular and uneven shape. During a breast self-examination, a cancerous lump may not move, but the tissue surrounding the lump may move. Classifications of breast cancer. Cancer begins as one or more cells that lose control of differentiation and proliferate but remain restricted in the basement membrane of the duct. These divisions invade the basement membrane of the canal and eventually spread to the distal organs as well. 4 different classifications or groups based on different causes that describe breast cancer. A. Pathology. Each tumor is graded based on its histological appearance and for other causes by a pathologist. The categories are invasive ductal carcinoma, malignant carcinoma of the breast ducts, invasive lobular carcinoma and malignant carcinoma of breast lobules. B. The pathologist determines the histological grade of the tumor under a microscope. A low-grade tumor resembles normal tissue. A high-grade tumor does not look like normal tissue and is made of disorganized cells. The middle class is between high and low grade. C. All breast cancers should be tested for expression or detectable effect of estrogen receptor, progesterone receptor, PR, and HER2 (NOI) proteins and performed by immunohistochemistry and will be presented in the pathologist's report. To predict the prognosis, an expression profile helps the oncologist to select the appropriate treatment. D. Tumor stage. TNM classification is the currently accepted staging scheme and is as follows. Tumor depends on the presence or absence of an invasive cancer, the dimensions of the invasive cancer and the presence or absence of an invasion outside the breast. There are 5 tumor classification values: TIS, T1, T2, T3 and T4. Lymph node. Depends on the number, size, and location of breast cancer cell deposits in the lymph nodes, and there are 4 lymph node classification values: N0, N1, N2 and N3. Metastasis. Depending on the presence or absence of breast cancer cells in locations other than the breast and lymph nodes, there are 2 values for the classification of metastasis: MO or M1. Causes of breast cancer. Breast cancers aren't always classified by their histological appearance. A breast lump is a dense mass of cells that appears wider than the surrounding tissues. Benign lumps are round or oval in shape, but the tumor may be partially round in any shapes according to its circumference. If the block has a multi-point star outline, it is known as speculation. If there is a dense lump that appears as a lump on a mammogram, an ultrasound of this breast mass should be taken. If the lump shows an irregular outline or has blurred edges and presses on surrounding tissues, then a person needs a biopsy of the lump. The most accurate way to diagnose their actual nature is to analyze a tissue sample. The exact cause of this cancer is unknown. The healthy BRCA1 and 2 genes act as suppressors for breast and ovarian tumors. BRCA genes mutated by radiation or chemicals can lead to cancer. The risk of developing a lump increases with age. About 17% of women diagnosed with breast cancer were in their 40s and 78% were over 50. General conditions for breast cancer. 1. Cancer is the term to describe cancer that begins in the epithelial cells of an organ. Most breast cancers are carcinomas. 2. Adenocarcinoma that begins in the glandular tissue. The glandular tissue in the breast is made of ducts and lobules, which is why it is known as adenocarcinoma. 3. The early stage of cancer, when confined to the layer of cells in which it started, is described by the term carcinoma in situ. Cancer cells remain confined to the ducts and lobules or in place, especially in breast cancer. These types have not invaded the tissues deep in the breast or have spread to other organs of the body and are referred to as noninvasive breast cancer. 4. That which has already spread beyond the layer of cells in which it started as an invasive or infiltrated cancer. Most breast cancers are invasive. Breast cancer is either invasive ductal carcinoma or invasive lobular carcinoma. 5. Cancers that start from connective tissues such as adipose tissue or blood vessels or sarcomas. Breast sarcomas are rare. Types of breast cancer. The different types of breast cancer are ductal carcinoma in situ, lobular carcinoma in situ, invasive ductal carcinoma and invasive lobular carcinoma. Less common types of breast cancer are inflammatory breast cancer, mixed neoplasms, myeloid carcinoma, metaplastic carcinoma, mucosal carcinoma, Paget's disease of the nipple, tubular carcinoma, papillary carcinoma, cystic adenocarcinoma, condyloma and angiosarcoma. Signs of breast cancer. Symptoms of breast cancer. The primary sign of this cancer is a lump that appears different from the surrounding tissue. 80% of a lump in the breast is discovered by the woman herself. Lumps in the lymph nodes in the armpit or collarbone can also indicate breast cancer. Other indications are a change in the size or shape of the breast, peeling of the skin, inverted nipple or spontaneous discharge from the nipple. For identifying breast cancer, pain is an unreliable tool, but it can also be due to other breast-related problems such as breast pain. Most of the symptoms lead to breast cancer. Some of the common causes of breast disorder symptoms are mastitis and fibrocystic adenoma. Any symptoms should be taken very seriously because there is a possibility of breast cancer at any age. Breast cancer prevention. Taking phytoestrogens in early teens like soy might protect against breast cancer later in life. But taking phytoestrogens in later life is unlikely to affect either positively or negatively. Avoid exposure to smoking or secondhand smoke. Secondhand smoke also causes breast cancer. Removing the ovaries in people at high risk after childbearing can reduce the risk of developing cancer in the breast by 60% and also reduce the risk of developing ovarian cancer. Breast cancer tests. The most common methods of testing for breast cancer are self-exams, clinical, mammograms and magnetic resonance imaging of the breast. Diagnosing breast cancer. By examining the breast tissue that is surgically removed, breast cancer can be diagnosed. Breast tissue can be taken by fine needle aspiration, nipple aspiration, ductal lavage, core needle biopsy and local surgical excision. Accurate diagnosis of this cancer includes radiography with these diagnostic steps. To detect metastasis, imaging tests are sometimes used and include chest X-rays, bone scans, computed tomography, magnetic resonance imaging, and positron emission tomography. Microscopic evaluation of the biopsy sample can provide a diagnosis of cancer. Breast cancer treatment. The primary treatment is tumor surgery with hormone therapy, chemotherapy and radiotherapy. In individuals with high risk, hormonal therapy has been used for chemoprophylaxis. The U.S. Food and Drug Administration has approved raloxifene to prevent invasive breast cancer in postmenopausal women. In the end, please activate the bell button, subscribe to the channel, to receive from us all that is new. For more information about breast cancer, please visit my own site. You will find the website link in the description. Thank you.